This is Bob. Bob has recently been bit by a bug and is developing a reddened, swollen hand.
What Bob doesn't know is that when the body reacts to a foreign substance, histamine and other substances are released from mast and basophil cells in response to antigens circulating in the blood. These histamine molecules then bind to H1 receptors on cells in the nose, eyes, skin, respiratory, and gastrointestinal tract. Once bound to receptor sites, these cells release even more histamine. Together, these effects produce the characteristic symptoms of allergies, including sneezing, running nose, headaches, stomach aches, watering eyes, redness, itching, rash, and edema due to dilation of blood vessels, increased capillary permeability, and the contraction of smooth muscles. First-generation non-selective antihistamines such as diphenhydramine are H1 antagonists that compete with histamine for H1 receptor sites. Antihistamines therefore block the histamines from binding and prevents its release and suppresses its effects.
So Bob decides to call telehealth.
Good afternoon, Telehealth Ontario. Heath speaking. How may I help you today?
Hello, Heath. I'm freaking out here. I got bit by something or stung by something, and my fingers are swollen and my hand's really hurting. Could you help me out?
It sounds like you're having an allergic reaction. Have you had reactions like this in the past?
No, I have not.
Are you feeling lightheaded? Do you have tightness in your chest, or are you having difficulty breathing?
No.
It sounds like you could benefit from a dose of diphenhydramine.
Diphen who?
Diphenhydramine. It's Benadryl. Have you had an adverse reaction to Benadryl in the past?
No.
Do you suffer from lower respiratory tract disease, increased intraocular pressure, renal disease, heart disease, hypertension, asthma, seizures, peptic ulcers, hyperthyroidism, enlarged prostate, bladder obstruction, or COPD?
No.
Are you between the age of 12 and 60 and free of renal complications?
I believe so, yes.
Do you happen to be pregnant or lactating?
Not at the moment.
Then I recommend that you take 25 to 50 milligram tablet of Benadryl every 4 to 6 hours until the symptoms begin to subside, and do not take more than 400 milligrams per day.
So, Heath, what is this medication going to do for me?
Its therapeutic effect is that it will relieve the redness, itching, and swelling associated with the allergic reaction you're experiencing. For people experiencing seasonal allergies, it also relieves red, tearing eyes, runny nose, and headaches. This medication could make you feel drowsy, so do not operate a vehicle or heavy machinery after taking the first dose. You may notice that you have a dry mouth, so you may want to suck on hard candies or ensure you have water to sip on. If you notice any changes in vision, difficulty urinating due to retention or dysuria, constipation, confusion, sedation, or faintness indicating hypotension, please discontinue and contact your doctor. If you feel tightening in your throat or difficulty breathing, this may be indicative of an anaphylactic reaction. Call 911 immediately if this occurs. Do not take with alcohol, MAOIs, or CNS depressants, as these will increase the chances of side effects and adverse events. Take a lower dose if combining with apple, grapefruit, or orange juice or St. John's wort, because it works best when there is less histamine circulating in the blood. If you experience a stomach ache or slight nausea with the first dose, take the subsequent dose with food. You may notice the onset is slower, but your GI symptoms will subside. Some people experience photosensitivity, so wear eye protection if you are outside.
So why are you asking me so many questions? It's freaking me out just a little bit.
Well, this medication is metabolized in the liver, excreted by the kidneys, crosses the placenta in pregnant women, and can also be excreted through breast milk. So it is important for us to gather a medical and personal history before we make a recommendation. If Because of the possible sedating effects, some people will experience a hangover-like effect, which is especially dangerous for elderly consumers as it increases their risk for falls.
So Bob decides to take the diphenhydramine. He reads the package and notices the warning, in case of overdose, call 911 immediately. At the hospital, they will administer diazepam, vasopressors, or short-acting barbiturates to reverse the effects of diphenhydramine. Within 30 minutes, Bob begins to feel better. Like most people, he feels slightly drowsy but does not experience any of the other side effects, which include dizziness, drowsiness, urinary retention, dysuria, urinary frequency, poor coordination, fatigue, anxiety, euphoria, confusion, paresthesia, neuritis, blurred vision, dilated pupils, tinnitus, nasal stuffiness, dry nose, throat and mouth, nausea, anorexia, diarrhea, photosensitivity, increased thickened secretions, wheezing, chest tightness, seizures, thrombocytopenia, agranulocytosis, hemorrhagic anemia, or anaphylaxis. His fingers are less red, swollen, and painful. Since the peak effect is 1 to 2 hours, the duration 4 hours, and half-life is 2 to 7 hours, Bob takes another dose at 4 hours to maintain the therapeutic effect. Even though Bob now knows what to do, he doesn't want to have to go through this again, so he calls his doctor for advice.
Hello, Fanshawe Medical Clinic. How may I be of assistance?
Bob tells the receptionist the story.
We would like to set up an appointment with you to determine what may have caused this reaction. We will refer you to a specialist for allergy skin testing. The Benadryl should be discontinued at least 4 days before you come in for testing to prevent a false negative. Always notify us if you have any distressing or respiratory symptoms, including increased bronchial secretions, wheezing, and chest tightness, and never take this medication while consuming alcohol or other CNS depressants.
Bob feels good that he has an appointment set up with this specialist, but he wants to know more, so he sets out to search the World Wide Web. And this is what he finds.
Do you wish that you could spend your whole day outdoors surrounded by a field of ragweed? Of course you do, because kissing in a field of ragweed is so romantic. Or playing with puppies? Who doesn't love puppies? Do you have a dream of becoming a beekeeper? Ouch, that's gotta hurt. Or just want to study for pharmacology while traveling in a car, plane, or train? But spontaneous allergy symptoms, insomnia, and motion sickness are getting in your way? If you answered yes, then diphenhydramine is for you.
Now Bob understands the many indications for the use of diphenhydramine, including allergic reactions, rhinitis, insomnia, and motion sickness. He can now sleep easy knowing that he need not worry about spontaneous allergic reactions. And if he still can't sleep, well, diphenhydramine can help with that too. Why don't you just say, let us know if you begin taking it long term?
Since we now know that you've been taking Benadryl,
Do you want to just cut out that one sentence and say, let us know if you begin using it long term?
sound it out. Thanks, buddy. Appreciate that.
So cross out from
Diphenhydramine.
since to 2. So cross out starting here. All the way to let. So just let us know if you begin using it long term, and we'll schedule blood tests to check your CBCs.
This is the longest conversation with my doctor I've ever had. Hold on a second. I wasn't ready.
Because you have so much to do.